Oxycodone by Morgan McAllister. Name, generic name, Oxycodone. Brand name, Percocet and Oxycontin. The chemical name is oxycodone hydrochloride. And some slang names is, or one slang name, hillbilly heroin. That's the most common name that you'll hear on the street. And the chemical formula is C18H21NO4. Classification. Oxycodone is classified as an opioid. Use of drug. Oxycodone is used to relieve moderate to severe pain. Oxycodone extended release tablets and extended release capsules are used to relieve severe pain in people who are expected to need pain medication around the clock for a long time and who cannot be treated with other medications. Mechanism of action. Oxycodone is a semi-synthetic morphine-like opioid alkaloid with analgesic activity. Oxycodone exerts its analgesic activity by binding to the mu receptors in the central nervous system, thereby mimicking the effects of endogenous opioids. Auxiliary label. Oxycontin tablets are to be swallowed whole and are not to be broken, chewed, or crushed. Taking broken, chewed, or crushed Oxycontin tablets leads to rapid release and absorption of a potentially fatal dose of oxycodone. And then there's just a little example of another auxiliary label down here at the bottom. It says, "Caution, federal law prohibits dispensing without prescription." Special precautions. Oxycodone may cause serious or life-threatening breathing problems, especially during the first 24 to 72 hours of your treatment and anytime your dose is increased. Your doctor will monitor you carefully during your treatment. Tell your doctor if you have or have ever had slowed breathing or asthma. Drug interactions. Diphenhydramine, found in some cold and allergy medications, can cause sedative effects and can be dangerous when added to the opioid sedative side effects. Contraindications. Oxycodone therapy is contraindicated in patients with respiratory depression, bronchial asthma in unmonitored settings, hypercarbia, hypersensitivity to oxycodone, and a known or suspected ileus or GI obstruction. Side effects. Dry mouth, stomach pain, drowsiness, flushing, headache, and mood changes. Dependence. Oxycodone is a powerful painkiller and one of the most abused prescription drugs in the country. Many people who abuse oxycodone start out taking a prescribed amount, and as their body develops a tolerance to the drug, they need a higher dose to maintain the same relief or high. Onset of action. The onset of action of oxycodone is 10 to 30 minutes for immediate release and about 1 hour for controlled release. Half-life. Duration ranges from 3 to 6 hours for immediate release or 12 hours in controlled release formulations. The plasma half-life is 3 to 5 hours, and stable plasma levels are reached within 24 to 36 hours. Excretion. The metabolism of oxycodone to oxymorphone is catalyzed by CYP2D6, free and conjugated noroxycodone, free and conjugated oxycodone, and oxymorphone are excreted in human urine following a single oral dose of oxycodone. Approximately 8 to 14% of the dose is excreted as free oxycodone over 24 hours after administration. Administration routes. The most common route of administration is to orally take a tablet. Some people can't take tablets without having a sick feeling in their stomach. In select countries, oxycodone may be available in intramuscular or intravenous forms as well. Available strengths. The oxycodone tablets come in 10 milligram, 20 milligram, 40 milligram, and 80 milligram strengths. You need a prescription for all doses of oxycodone because it is a Schedule II controlled substance, meaning it is an addictive drug. So I have a picture here of each strength of tablet, and they all look different. They're all different colors. So 10 is white, 20 is kind of like a violet color, and 40 is orange, and 80 looks like a green color. They're all round. Thank you. I appreciate you taking the time to view my presentation. I hope you were able to get something out of this. I think it is very important to have knowledge on drugs of this caliber. I had a lot of fun researching and presenting this.